Hello, my name is Ed Frontera, and I am a nationally certified trainer in mental health first aid. I look forward to bringing this course to you. Here, we're going to do introductory materials, giving you the foundations and the history of the program. And then later, we're going to get together live and in person. I'll have a chance to meet you and practice the skills of mental health first aid. I'm a college professor, currently at Palm Beach State College. I've taught at Lynn University and now with the National Council for Mental Well-Being. Let's introduce you to the core concepts of mental health first aid.
By the end of the online portion of this course, you will be able to describe the purpose of youth mental health first aid and the role of the first aider. Recognize the signs and symptoms of mental health or substance use challenges that may impact youth. Explain the role of resilience and the impact of traumatic experiences on adolescent development. And learn the steps of the ALGE action plan. During the instructor-led portion of the training, you will apply the appropriate steps of the ALGE action plan to crisis and non-crisis scenarios. Next, we will learn more about the origins of youth mental health first aid.
All right, so you can start and stop this video as you need to. Come back and complete it anytime before our live in-person training. Here we go.
What is youth mental health first aid? It is the help offered to a young person experiencing a mental health challenge, mental disorder, or a mental health crisis. The first aid is given until appropriate help is received, or until the crisis resolves. Just as a CPR course will not teach a person how to perform heart surgery, youth mental health first aid will not teach a person how to provide professional care and treatment. This course will help a person recognize and respond to the symptoms of mental health and substance use challenges in youth. Youth mental health first aid was adapted from the original Australian program by a team of physicians, mental health professionals, and educators to meet the social and cultural needs of U.S. youth and their families. Millions of people have been trained in mental health first aid in the United States. This was made possible thanks to thousands of instructors who are dedicated to being the difference in their communities. A core aspect of giving mental health first aid is being fully present and listening. As human beings, we have a fundamental need to be understood, not necessarily agreed with, but understood. Being fully present and truly listening can help minimize feelings of distress, and may be the most effective step as you help someone seek support or treatment that fosters their well-being. Some of you may be attending this training as educators, youth program or school staff, service providers, parents/caregivers, friends, or some other capacity. Whatever our roles are in the lives of young people, it's important to know that mental health challenges are more common than you think, and when a young person is struggling, it is up to us to notice. Let's watch a brief video that will help you understand why youth mental health first aid is important.
The following video includes a discussion of risk factors that increase the chances of a person being adversely affected by a circumstance or disorder. Viewing this video may be distressing for some of us. If needed, please consider putting distance between yourself and this video, leaning into self-care, and reaching out to your instructors for support.
Hello, Mrs. Jones.
Hey, CJ.
Coach.
Emma.
Mom.
Last year I experimented with painkillers, and then I started taking them every day.
174 days ago, I started intentionally vomiting after meals.
My anterior cingulate cortex has a population of overactive neurons.
Cutting my arms has become a compulsive behavior.
I started having suicidal thoughts.
Can you help me find the proper support and medical resources?
Can you help me research the best treatment facilities?
I'd love to chat with you about ideas on how to help manage this.
As adults, we expect young people to reach out to us when they need help. But as was demonstrated in the video, many young people may not have the skills or language to tell us when they're experiencing a challenge. That is why mental health first aid is so important. This course teaches how to connect with a young person who is struggling with a mental health or substance use challenge. The skills that you will learn in this course reflect the values of mental health first aid. Specifically, you will learn the importance of noticing, being fully present when a young person is sharing, creating parallels between mental health and physical health, doing your part to reduce stigma and barriers, and knowing our role in supporting young people while also knowing how and when to tag in professionals. You will continue to learn about the values of mental health first aid throughout this course. Another tool that you will learn in this course is the Algae Action Plan. The Algae Action Plan was developed as a tool for first aiders to recognize and respond to a young person experiencing a mental health or substance use challenge. Using the action plan helps first aiders have supportive conversations with young people and serve as a vital link to early intervention. A useful mnemonic or memory device to help us remember the action plan is Algae. The action plan is non-linear, which means a first aider can use any or all actions that fit the situation while they're supporting a young person. A. Assess for risk of suicide or harm. L. Listen non-judgmentally. G. Give reassurance and information. E. Encourage appropriate professional help. E. Encourage self-help and other support strategies. When first aiders notice signs and symptoms in young people's appearance, behaviors, express thoughts, and feelings, we can reach out using the action plan as our guide. As a reminder, during the in-person component, we'll apply what we've learned to scenarios. Now let's learn about each step of our action plan. As mentioned before, the mental health first aid action plan is nonlinear. Central to the action plan is the A step, assessing for risk of suicide or harm. As mental health first aiders, we are always assessing situations. Similar to how a driver is always assessing their surroundings to ensure safety, a mental health first aider is always assessing situations to ensure safety for all involved. Assess is at the center because safety is paramount for all involved, and as first aiders, we are always assessing for crisis situations. During the instructor-led portion of the course, we'll apply what we've learned to scenarios. Select each letter to learn more. The A step in the action plan includes another step, approach. The L step stands for listen non-judgmentally. G is for giving reassurance and information or The first E in our action plan is encouraging appropriate professional help. The second E is focused on encouraging self-help and other support strategies. What is the role of the mental health first aider? Specifically, what is within the scope of a mental health first aider, and what is outside of our lane as mental health first aiders? Let's spend some time outlining the role of a mental health first aider. First aiders do not diagnose or treat themselves or others. This is critical for mental health first aiders to understand. Similar to how diagnosing medical conditions requires advanced training, diagnosing mental health conditions also requires extensive training. Professionals like doctors, advanced practitioners, psychologists, mental health clinicians can diagnose and or treat. So, if you didn't come to this course with that level of training, you will not leave this course being able to diagnose and treat. If you are a professional with that level of advanced training in the areas of mental health or substance use, you may find that mental health first aid helps you better identify how to support young people outside of the workplace. First aiders observe changes in behaviors. Because the signs and symptoms of mental health or substance use challenges often appear before seeing a professional, first aiders can play a critical role in noticing and connecting young people to care. While it is important to pay attention to changes in young people, we also want to be careful not to assume that all changes in young people are always connected to mental health or substance use challenges. First aiders offer a non-judgmental, listening ear. Listening non-judgmentally is a powerful tool in a first aider's toolbox. Holding space with a young person that is safe and non-judgmental can have a powerful healing effect. It sends the messages of "you are not alone, I care for you," what you're going through matters to a young person. During this course, we will learn more key tips on how to listen non-judgmentally and practice this important skill. First aiders respect the privacy of the youth and family. Do young people have the right to privacy? Do families? Yes. We never want to share information about young people or their families without their consent. However, if there is risk of harm to self or others, we need to report. You can find more information about mandatory reporting and privacy in your manual. Mental health first aid does not replace any professional responsibilities, legal responsibilities, or organizational procedures a first aider has as a mandatory reporter, first responder, clinician, or government employee. If you're not sure about your workplace policies related to mandatory reporting or confidentiality, take the time to find out. First aiders serve as a vital link to early intervention. Similar to how getting help early for physical health conditions is important, getting help for mental health challenges is also important. We can play an important role in connecting young people to getting help early. How we help and who we connect the young person to can vary based on our relationship and role with the young person. It is important to note that you are never obligated to provide mental health first aid. Mental health first aid is a tool you can use at your own discretion. Safety of all involved is paramount. Let's make sure we understand our role as a mental health first aider. Remember, first aiders do not diagnose or treat themselves or others. First aiders observe changes in behaviors. First aiders offer a non-judgmental, listening ear. First aiders respect an individual's privacy. First aiders serve as a vital link to early intervention. Let's review a few key takeaways from this section. Youth mental health first aid is the help offered to a young person experiencing a mental health challenge or crisis. First aiders do not diagnose themselves or others. Rather, they observe changes in behaviors and offer a non-judgmental listening ear. Mental health first aid does not supersede any professional, legal, or organizational obligations that a first aider may be bound to. Next, we will learn about mental health and mental illness in youth. The objective for this section is to recognize the signs and symptoms of mental health and substance use disorders that may impact youth. Before you can recognize the signs and symptoms of mental and substance use disorders, you must first be able to define mental health and mental illness. Examine the impact of culture on health. Identify common mental health and substance use disorders. Explain how common mental disorders are in youth, and when they first occur in children and youth. Recognize the importance of early intervention. Explain the impact of stigma on seeking treatment and care. Let's get started. What is mental health? The World Mental Health Organization defines mental health as a state of well-being in which the individual realizes their own abilities, can cope with the normal stress of life, can work productively, and is able to make a contribution to their community. When thinking about health, it is important to consider the many factors that influence our health. One of those factors is culture. Let's take a look at how culture impacts mental health. Before we talk about how culture influences the health of young people and families, let's define the term culture. Culture can be defined as the shared patterns of behaviors, interactions, thinking, and understanding that are learned through the groups we belong to and identities we hold. Shared experiences plus the intersection of identities suggests that culture is both collective and individual. Cultural beliefs influence our health decisions each day, every day. Culture influences our health choices, behaviors, and values about health and health care. Who we go to for support. What we think causes good and bad health. And what health means to us. Culture impacts what young people and their families may think about mental health, how they talk about it, and how they treat it. As mental health first aiders, it is important that we remember the connection between health and culture so we can support young people experiencing a mental health challenge from the cultural spaces they occupy, instead of the cultural spaces that we as adult mental health first aiders occupy. By practicing cultural awareness, mental health first aiders can have more respectful conversations with young people and their families and better address any concerns or barriers they may have about getting help if they are struggling. Let's now shift gears to talk about what a mental health challenge is. The term mental health challenge is an umbrella term that includes early or worsening signs and symptoms, as well as signs and symptoms of a crisis. A mental health challenge is when there is a major change in a person's thinking, feeling, or acting. The change interferes with the person's ability to live their life. The interference does not go away quickly and lasts longer than typical emotions or reactions would be expected to. It is important to note that we don't have to limit ourselves in supporting only those young people who have a diagnosis. Youth in our lives may or may not have a diagnosis, and we don't need to know that information to be able to provide support. Therefore, using the term mental health challenge can be useful because this term is inclusive of early warning signs, worsening symptoms, or crisis signs and symptoms. When we broaden our language and the way we talk about mental health, we can also broaden our opportunities to support young people. So, what is a mental illness or mental disorder? We will use the terms mental disorder and mental illness interchangeably. Our working definition for this course is: a mental health disorder or mental illness is a diagnosable illness that affects a person's thinking, emotional state, and behavior. Disrupts the person's ability to work or attend school. Carry out daily activities. Engage in satisfying relationships. Mental disorders have specific criteria for diagnoses and can only be diagnosed by qualified mental health or medical professionals. As a reminder, we do not learn how to diagnose a person with a mental disorder in mental health first aid. Do you think it is possible to have a mental disorder and good mental health? Think about a person with a chronic medical condition, like high blood pressure. A person with high blood pressure who eats a healthy diet, exercises regularly, and partners with their doctor to manage symptoms through medication and other treatments can live a full and active life, with minimal disruptions to their daily activities. On the other hand, a person with high blood pressure that does not follow their doctor's advice, eats a poor diet, and avoids exercise is more likely to experience adverse effects of high blood pressure, including a worsening of symptoms or an escalation to a medical emergency. Mental disorders can have a similar impact on a person's mental health. It can be helpful to think about mental health in terms of a continuum with quadrants. On one axis, we have optimal mental health and poor mental health. A youth may have no diagnosis of mental illness and positive mental health. Or they may have a diagnosis of a serious mental illness, but copes well, and has optimal mental health. On the other axis, we have no mental illness and severe mental illness. A youth may have no diagnosis of mental illness and poor mental health. Or they may have a diagnosis of a serious mental illness and has poor mental health. When we think of youth particularly, they may not have had the opportunity to be seen by a provider that can diagnose them with a mental disorder. It is also important to recognize that young people can vary in their position along these continuums at different points in their life. How common do you think mental disorders are in youth? Quick question. How many youth in the United States will experience a mental disorder at some point in their life? 1 in 10. 1 in 5. 1 in 20. Select the correct response. 1 in 5 youth will be diagnosed with a mental disorder in their lifetime. That means out of 25 students in a classroom, 5 may be impacted by a mental health challenge or disorder. Mental health challenges are common, and it is likely that we all know a young person who is impacted. This is why it is so important that you're in this training to learn more about how to help, because without early intervention, research shows mental health disorders that emerge in childhood tend to be more severe and persist for longer than those that emerge later in life. Youth who develop a mental health disorder are also at a greater risk of developing additional mental health or substance use disorders. First, let's begin by learning more about some of the most common mental disorders.
In our virtual gallery exercise,
You will get the opportunity to learn about some of the most common mental disorders that impact youth. The Mental Health First Aid Manual for Adults Assisting Children and Youth includes a full chapter on each of these disorders with detailed information about the disorder, how likely it is that youth will experience that disorder, and other relevant statistics, the signs and symptoms that a youth mental health first aider might notice if a young person was experiencing that disorder, and risk factors or reasons that a young person might be more likely to experience that type of disorder. Finally, each chapter explains how mental health first aiders can use the ALGE action steps to specially assist a young person that might be experiencing signs and symptoms of that disorder. The gallery exercise includes some of the most critical information that first aiders need to know about each disorder. Select each of the disorders in this gallery to learn more. You will then be able to go to the youth manual to get additional information and guidance after the course. Anxiety is a feeling of a threat or worry caused by perceived threats in the environment. Each young person with anxiety can have a different range of worries and responses to anxiety. An anxiety disorder differs from everyday anxiety in the following ways. It is more severe. It is persistent. It interferes with the person's studies, other activities, and family and social relationships. Approximately 8.3% of youth will be diagnosed with an anxiety disorder during their lifetime. Anxiety is one of the most common mental disorders that occurs in children and youth. Many of the adults who currently live with an anxiety disorder began to show symptoms of anxiety in their childhood. Individuals can develop each of these disorders before or after these ranges, but these ranges are the middle of the distribution for all youth who will experience these mental illnesses. These age ranges are not the only times when an individual may develop a mental disorder. Instead, this illustrates that the major types of mental illnesses frequently develop during adolescence. Half of all mental illnesses develop by age 14, and 75% by age 24. Since most disorders develop in adolescence, we have an incredible opportunity to notice and connect to care. Select each box to reveal the median age of onset. Half of all mood disorders show up by age 13. Half of all ADHD and behavior disorders show up by age 11. Half of all anxiety disorders show up by age 6. Half of all substance use disorders show up by age 15. Youth mental health first aid is just one piece of the puzzle when it comes to responding to the mental health needs of adolescents. It is part of the wide spectrum of interventions that are available to prevent, treat, and recover from mental health challenges or disorders. There are different types of interventions that are appropriate across a young person's journey through illness and recovery. Select the button below to learn more about where youth mental health first aid fits in these interventions. Programs intended to prevent the development of a mental illness. Early intervention programs intended for those beginning to develop symptoms that are disrupting their functioning. Treatments and supports intended for people who are becoming unwell, are learning to live with, and or recover from a mental illness. Mental health first aid can have an impact across the spectrum of interventions, however its primary impact is in early intervention. When we say early intervention, we are referring to recognizing the warning signs of a mental health or substance use challenge and acting on it before it worsens. Early intervention is critical to positive outcomes. The earlier the intervention, the better the outcome. If a young person is impacted by childhood diabetes, we can imagine what a difference the correct diagnosis, treatment, and interventions might mean not just in their childhood but to their health throughout their life. Mental illnesses are no different. Early intervention is key. Some examples of secondary effects of mental health or substance use challenges can be school dropout, relationship breakups, arrest or problems with the law, drug or alcohol problems. However, with early intervention, the risk of these secondary effects can be lowered. Early intervention may not always be possible. Sometimes youth or their families may not speak up about their challenges or want to ask for help, even when their life is impacted by the symptoms. Why do you think people are reluctant? Why do many not want to talk about changes in their mental health? Stigma around mental health challenges are negative attitudes toward people with mental health challenges. Stigma can lead to discrimination, which is when people with mental health challenges are treated differently because of their illness. Stigma can make it hard for people to talk about their problems and get help. The way we talk about mental illnesses, the messages in movies, television, in the news, and in everyday conversations can all impact the way we see mental illnesses and recovery. It is important to have an accurate view of mental challenges or disorders, and often the information we hear is inaccurate and full of stigma. One of the first tools in our toolbox that we'll discuss now and continue to come back to throughout the course is the language we can use. Language has power. The words we use can have power to hurt and stigmatize, but can also help us to connect and heal. The use of person-first language can reduce stigma, and also the distance between someone and hope and help. Person-first language, language used to acknowledge that the diagnosis, mental health challenge, or disability is not as important as the person's individuality and humanity. Mental health first aiders use person-first language. Select each box to reveal the correct language. Say a person living with schizophrenia instead of a schizophrenic. Say a person diagnosed with bipolar disorder instead of a manic depressive. Say a person without housing instead of a homeless person. Say a person who uses drugs instead of a drug addict. We have talked about the impact of stigma and how it can prevent people from getting help. We are now going to talk about some of the other reasons for gaps in treatment. To start, let us explore the gap in treatment that exists in the United States. About half of all mental disorders begin by age 14, and 3/4 by age 24. However, research has found that only 7.4% of all youth receive any type of mental health visits or screening each year. This is of serious concern because without proper screening, youth experiencing a mental health challenge are not likely to get the help they need. In fact, of the nearly 3.1 million youth that experienced one major depressive episode in the past year, fewer than half, only 40.9% received treatment for depression. When untreated, mental health disorders are likely to worsen, persist into adulthood, and contribute to functional impairment in a variety of domains. We know stigma is one barrier to treatment for mental health challenges that we have talked about. What are some other barriers to care in our communities? Cost. A significant barrier to care for many families is cost of treatment. Insurance coverage, when available, can be inadequate and may come with high deductibles or copays. Logistics. Issues such as transportation, school or work schedules, childcare for other family members, office hours of service providers, etc. can serve as barriers to care. Awareness. A lack of awareness or understanding about mental health disorders can serve as a barrier to treatment. Many adults have difficulty discerning between typical adolescent behavior and signs or symptoms of a mental health disorder. There may be additional barriers to treatment in the communities where you live. For example, many rural communities are experiencing a shortage of mental health professionals, which can make it more challenging for rural youth to get behavioral health services. Additional barriers to treatment can be caused by bias, stereotype, stigma, racism, and discrimination, which impacts access to appropriate and quality mental health services. Discrimination in health services and communication barriers between mental health professionals, youth, and families can lead to distrust and negative outcomes. Discrimination can be a result of race or ethnicity, socioeconomic status, education, age, gender identity and/or expression, sexual orientation, disability status, or legal citizenship status. Although there are many barriers to care that can affect youth and families, mental health first aiders can help a young person and their family navigate those barriers so that the youth can get appropriate care. It's time for a knowledge check. Select the Start button to begin.
True or false? Mental disorders are common in adolescents, with 1 in 5 experiencing a mental disorder in their lifetime.
You selected the correct response. Good job. Belonging to a culture impacts our health choices. What health means to us. Our behaviors. All of the above. Select the correct response. You selected the correct response. Good job. True or false? Stigma around mental health cannot lead a person to delay treatment or not seek treatment at all. Not quite. The correct answer is false. Blank is a state of well-being in which the individual realizes their own abilities, can cope with the stresses of life, can work productively and fruitfully, and can contribute to their community. Mental health. Mental illness. A mental disorder. Or a mental health challenge. Select the correct response. You selected the correct response. True or false? Early intervention helps to prevent symptoms from becoming more serious and reduces risk of secondary effects of mental health or substance use problems. Not quite. The correct answer is true. The main objective for this section is to explain the impact of traumatic experiences and the role of resilience and protective factors on adolescent development. First, we will define typical adolescent development and highlight key changes that occur to a youth's physical, cognitive, social, and emotional development. Next, we will identify risk factors that increase the chance a young person will develop mental health and substance use challenges. We will examine the impact of adverse childhood experiences, ACEs, and other traumatic experiences. And finally, we will identify protective factors that reduce the risk that a young person will develop mental health and substance use challenges and examine the role of resilience in typical adolescent development. Let's get started. Adolescence is a time of significant change as children transition towards adulthood. This stage of development involves physical, cognitive, social, and emotional changes. Every culture defines the period of adolescence differently. Some cultures see this transition as a long period of time, where behaviors are expected to become increasingly more adult over time. While other cultures expect the transition to occur in a shorter period of time, and expect adult behaviors while adolescents are still in their teens. It is important to note that although cultures may define the time period of adolescence differently, nearly every culture recognizes a period of adolescence. Some cultures honor the transition period with a celebration. For example, many Latinx cultures will mark the transition from girlhood to womanhood with a quinceañera on her 15th birthday. Jewish cultures will honor a child's transition to adulthood with a bar mitzvah, for males, at age 13, or a bat mitzvah, for females, at age 12 or 13. Some communities and families emphasize the transition to adulthood by holding a different set of expectations as the child increases in age. Some examples of changes in age-related expectations include getting a driver's license, contributing financially to the household, going to college or starting to work, or taking on more responsibility in the home with chores or siblings. Some of the many changes that occur during adolescence can be categorized into 4 major areas: physical changes, cognitive changes, social changes, and emotional changes. In adolescence, the body can change minimally or drastically. Some common physical developmental changes in adolescence include an increase in muscle mass, bone density, hormonal changes, changes to the octave levels of the voice, increase in height and weight, even changes to shape of the body, developing secondary sex characteristics, such as pubic hair, breasts, and widened hips in biologically female bodies, and facial hair and Adam's apples in biologically male bodies. As the brain develops in adolescence, young people develop more abstract thinking skills, which are important because they allow youth to develop a deeper understanding of the bigger picture. Another example of cognitive changes during this time period is the use of reasoning and logic. During adolescence, young people begin to utilize reasoning and logic more as they make decisions and increase their ability to futurize how decisions may impact them. Additionally, during this time period, young people's awareness of physical appearance and desire for social acceptance often becomes much more heightened. Lastly, youth begin to form their own beliefs and question authority. Forming their own beliefs about themselves, their surroundings, and the people around them is an important component of becoming an adult. Let's talk about changes in social development that are common in adolescence. It is common for young people to have an increase in risk-taking and impulsive behaviors. However, not all risk-taking behaviors are necessarily dangerous. For example, for some young people, trying out for a play or a sports team may be an example of a risk-taking behavior. For others, risk-taking behaviors may involve experimenting with substance use. Experimenting with different levels of social and cultural identity can be an important part of adolescence. For some, this may involve examining and evaluating their religious identity, racial identity, political identity, gender identity, sexual identity, or peer group participation. During adolescence, young people are often also learning how to manage relationships, familial relationships, friendships, professional relationships, or romantic relationships. As part of social development during this time period, there is also an increase in influence of peer groups. Finally, youth have an increased awareness of their sexual identity. Finally, let's review some key emotional changes that may occur during typical adolescence. Youth may begin to develop a sense of identity. An adolescent's beliefs about themselves and their self-esteem influence the adolescent's identity. Moods can shift quickly. Adolescents are developing executive function skills, including emotional regulation. Adolescents are more prone to expressing abrupt shifts in mood. Developing empathy and cooperation. Adolescents begin to regard moral choices as important to maintaining social order and ensuring positive relationships. Learning to resolve conflicts constructively. With developing executive functioning skills, adolescents are better able to resolve conflicts verbally and in a way that is beneficial for all parties. Recognizing and managing emotions. Adolescents are better able to identify their emotions and things that elicit those emotions. This helps them be better able to positively and proactively respond to their emotions. Let's review what we have just learned. Select each category to reveal some of the changes that occur during adolescence. During an adolescent's physical development, hormonal changes occur. Questioning authority often occurs as a part of an adolescent's cognitive development. As adolescents develop socially, there is usually an increase in peer influence. Recognizing emotions are a part of an adolescent's emotional development. Now that we can identify some key features of typical adolescent development, it's time to take a look at some of the factors that influence the development. Adolescent development is influenced on multiple levels: biological, psychological, familial, social, and cultural levels. Many mental health disorders share risk factors, so we present them together. Viewing adolescent development in this way helps adults working with youth understand the range of factors that put youth at risk for mental health or substance use challenges, or the factors that can be strengthened to increase children's resilience. Next, we are going to watch a video that describes risk and protective factors and how they impact child and adolescent development.
The following video includes a discussion of risk factors that increase the chances of a person being adversely affected by a circumstance or disorder. Viewing this video may be distressing for some of us. If needed, please consider putting distance between yourself and this video, leaning into self-care, and reaching out to your instructors for support.
As a mental health first aider, you play a critical role in responding to the signs and symptoms of a mental health challenge in a child or youth. This video will prepare you to promote the mental health of young people by understanding the things that influence their lives. It will help you identify when children and youth are facing increased risk and the valuable role you play in building up young people's strengths and connecting them with positive supports that are linked to healthy growth and development. Risk factors are experiences that can increase the risk of a young person developing a mental health challenge. Risk factors can be biological, like a family history of mental illness, psychological, like experiencing traumatic stress. They can be caused by losing a loved one or going through a divorce, or they can be a result of being bullied or living in poverty. One risk factor that is especially important for first aiders to know about is trauma, a risk factor for nearly all mental health and substance use disorders. Trauma results from an event or a set of circumstances experienced by an individual as physically or emotionally harmful, and that has lasting adverse effects on the individual's functioning and overall well-being. Traumatic experiences that happen during childhood are called adverse childhood experiences, or ACEs. ACEs can include experiencing or witnessing violence and abuse, instability due to parental separation, or the incarceration of a member of the household. Such experiences can make children feel unsafe, insecure, or even impact bonding with caregivers. The good news is, many children demonstrate a remarkable ability to overcome the challenges caused by ACEs. The ability to overcome these challenges is called resilience. A network of support is key in helping children develop resilience. In fact, the most common factor for children who are able to develop resilience is having at least one stable, committed relationship with a supportive adult. Building resilience works like this. Think about a scale or teeter-totter. On one side are risk factors, but on the other side are protective factors. Protective factors can be biological or psychological, including body regulation, emotion regulation, and critical thinking skills. Protective factors can also be connected to family, school, and social supports, like interactions with supportive adults. Adults can help children learn to cope and connect them with supportive community resources to reduce risk and promote more protective influences in the child's life. Supportive adults like you can tip the scales toward resilience.
As stated in the video, risk factors are experiences or elements that can increase the risk of youth developing a mental health or substance use challenge or crisis. Which risk factors do you see most in young people you work with? Check all that apply. Adverse childhood experiences. Challenges with peers at school. History of family mental illness or addiction. Poverty. Exposure to violence in the school or community. Good job. It is important to be mindful of risk factors that may be present. Protective factors are environments, supports, and behaviors that act opposite to risk factors. The more protective factors that are present, the more likely that a youth will be resilient and can cope with any challenges they experience. What are some protective factors that you can promote as a mental health first aider? Healthy self-care practices. Positive coping strategies. Sense of belonging in school and community. Regular school attendance and academic engagement. All of the above. Select the correct response. You selected the correct response. Good job. Now we will take a closer look at some significant risk factors that impact youth, violence and bullying. Unfortunately, violence is a common experience for youth. Experiencing violence, whether in school, in the community, or at home, can be very traumatic. Violence is an example of a traumatic event, and it comes in many forms, including sexual abuse or assault, physical fights or physical abuse, bullying or harassment. School shootings are often the example adults and youth think of when we consider how violence can impact the lives of youth. In fact, a recent survey found that 75% of youth report that mass shootings and school shootings are significant sources of stress. The Youth Manual has additional information about school shootings and mass violence in Chapter 1.3, including recommendations for first aiders working in schools and tips for talking to youth about school shootings. There are a few important things to remember. School shootings do happen, and they are certainly scary and tragic incidents, but these situations are rare. The media often perpetuates the stereotype that mass shootings are caused by people with mental illness. This is a myth and can lead to greater stigma for people experiencing mental illness. Research suggests that individuals diagnosed with mental illness are more likely to be victims as opposed to perpetrators of violence. Students are the most frequent reporters of another student's threat to harm someone. When youth feel that they are in a safe and supportive school and have an adult they can go to, they are more likely to report a potentially threatening situation. While school shootings are rare, bullying is one of the most common forms of violence that impacts teens. 1 in 5 American high school students reports being bullied at school. Bullying has serious and lasting negative effects on the mental health and overall well-being of youth involved in the bullying, whether the youth is bullying, the youth is being bullied, or even if the youth is a friend who is witnessing bullying. First aiders should be aware that both the bullied youth and youth doing the bullying can have mental health challenges and may be in need of support. Chapter 1.3 in the Youth Manual provides additional information about bullying. Next, we'll talk about another factor that influences adolescent development: social media. As youth are increasingly spending more time online through social media, it is important to understand how social media impacts their mental health. As we have discussed, adolescence is a period of personal and social identity formation, and it will come as no surprise that much of this development is now intertwined with social media. 9 in 10 teens and young adults report using social media. 80% say they use it daily.
Do you think social media has an overall positive or negative influence on a young person's mental health? Select the option that best shows what you think.
On the plus side, when surveyed, teens report that they feel connected with their peers in society. Social media can promote feelings of belonging, especially in teens with specific interests that aren't shared by peers at school. Social media can provide access to help and support for teens experiencing thoughts of suicide. Social media can strengthen the bonds teens have with existing friends and help them form new friendships online, which reduces social isolation and loneliness. These factors can directly and indirectly improve mental health. On the downside, social media can increase exposure to cyberbullying. In fact, 1 in 6 American high school students experiences cyberbullying. Teens report they experience increased feelings of envy, inadequacy, and lower life satisfaction while using social media. Social media can increase the pressure young people to constantly show themselves in the best light, and can increase comparison between peers. Social media and use of devices can impact sleep and distract from daily activities. These factors can directly and indirectly impact mental health. Mental health first aiders can help young people enjoy the benefits of social media while reducing the negative aspects. Conversations with youth about social media might include asking them about the benefits and drawbacks of using social media and how they feel while using it. Young people who report that they are losing sleep or not finishing schoolwork might need some help self-regulating their social media use to take breaks when needed. It's time for a knowledge check. Select the Start button to begin. You selected the correct response. Blank is a risk factor for nearly all mental health and substance use disorders. Gender, education, or trauma. You selected the correct response. True or false? Protective factors do not act opposite to risk factors. The more protective factors that are present, the more likely a child is to develop a mental health or substance use disorder. You selected the correct response. Blank. Increase the likelihood of developing a mental illness or addiction. Risk. You selected the correct response. Adolescent development involves changes in these broad areas: physical, cognitive, social, emotional, or all of the above. You selected the correct response. Good job. The learning objective for this segment is to recognize the signs and symptoms of mental health or substance use challenges that may impact youth. To reach this objective, you will define signs and symptoms. Explain when signs and symptoms indicate a concern. Compare typical adolescent behaviors with warning signs of a mental health or substance use challenge. Identify behavioral and physical signs and thoughts and feelings that may be symptoms of a mental health or substance use challenge. Let's get started. What is the difference between signs and symptoms? Signs are observable and measurable. A first aider can notice signs, such as changes in behavior or appearance, without a youth necessarily saying that something is going on. Symptoms are not observable. They are internal feelings that a youth may describe. Symptoms are indicators of a physical or mental challenge that a person can feel. As a first aider, we can be aware of changes in a youth's appearance and behaviors, and to listen and respond if a youth describes thoughts or feelings that can indicate a mental health or substance use challenge. Every youth will experience ups and downs in their thoughts and feelings. However, it is important to recognize when thoughts, behaviors, feelings, and appearance indicate a potential mental health or substance use challenge. This slide shows some of the physical signs and symptoms that a young person may be experiencing that indicate a health or mental health concern. A first aider may be able to notice some of these signs, such as chills or sweating, quick, deep breathing, or a decline in personal hygiene. Others are symptoms that a youth may tell you about, such as stomach concerns or rapidly beating heart. Mental health first aiders should call 911 right away if a youth is experiencing signs and symptoms that indicate a medical emergency. Mental health first aiders should also refer a young person to a medical professional to rule out a physical health concern. This is not an exhaustive list of the physical changes to appearance and well-being that can occur in a young person's body when they are experiencing a physical or mental health challenge, but it gives us a good idea of some of the signs and symptoms we should be noticing. When trying to identify the signs and symptoms of a mental health disorder, it is also helpful to think about the youth's behaviors. A behavior is an observable action. This is a list of common behaviors that may indicate that a child is experiencing symptoms of a mental health challenge or disorder. Crying spells, withdrawal from others, inability to manage responsibilities, seemingly disinterested in personal appearance, loss of motivation, slow movement, use of drugs and alcohol, changes in energy level, obsessive or compulsive behavior, self-injury. Many of these signs and symptoms could be shared by a variety of disorders. Remember, it is not in the scope of a first aider to diagnose a young person with a mental health or substance use disorder, but rather to notice and connect with the youth. Let's delve into the last point: self-injury. Non-suicidal self-injury, NSSI, is an intentional injury to the body that is not a suicide attempt. Many terms are used to describe self-injury, including self-harm and self-directed violence. For most young people, self-harm is a coping mechanism, not a suicide attempt. Even when suicide is not the goal, self-harm can still cause severe injury or death. Select the Learn More button below for more information about NSSI. Unlike behaviors, thoughts are not observable. A youth will have to tell you what and how they are thinking. Still, there are signs that a youth is experiencing a change in their thoughts. As a first aider, you might notice frequent self-criticism or self-blame, pessimism, difficulty making decisions, concentrating or remembering, rigid thinking, racing thoughts, altered sense of self, tendency to believe others see one in a negative light, delusions or hallucinations, odd ideas, thoughts of death and suicide. As first aiders, it is important not to condescend, patronize, or tell youth their thinking is wrong. This is not helpful for the young person. During the instructor-led portion of this course, you will learn strategies to help you communicate with a young person who may be experiencing a change in their thoughts. Like thoughts, feelings are not observable. You may notice a change in behaviors, such as sullenness or angry outbursts, but a youth will have to tell you what they are feeling. This is a list of common signs that may indicate a youth is experiencing symptoms of a mental health or substance use disorder. Depressed mood and or mood swings. Unrealistic or excessive anxiety or guilt. Excessive irritability or anger. The term excessive helps us differentiate between typical irritability or anger that could be a sign or symptom. Lack of inhibition. Lack of emotion or emotional response. Helplessness or hopelessness. Oversensitivity to comments or criticism. Low self-esteem. Some people are more emotional than others. We should be looking for changes in the youth's particular pattern as opposed to specific responses. Every youth will experience ups and downs in their thoughts and feelings. However, it is important to recognize when thoughts, behaviors, feelings, and appearance indicate a potential mental health or substance use challenge. We use 3 categories to determine if the signs and symptoms are becoming a challenge: frequency, duration, and impact. Frequency refers to how many symptoms the individual has, how often the symptoms are occurring, and if the individual experiences signs and symptoms most of the day or many times per day. Duration refers to how long the symptoms have been present, and that the symptoms have been present for a certain amount of time. It is normal to have good and bad days, positive and negative emotions. However, symptoms can be an indicator of a mental health or substance use disorder if they have been present for a certain amount of time. The amount of time differs based on the condition. Impact refers to the degree the symptoms interfere with the youth's ability to function. Symptoms may indicate a challenge if the youth is having a difficult time coping. Remember, as first aiders, we are not diagnosing but paying attention to signs and symptoms. We want to pay attention when these signs and symptoms are outside of what we would expect for a youth of that age, getting in the way of school performance, relationships with family or peers, and or ability to participate in usual activities, present across settings, persistent over time. Adolescence is a time of significant change for all youth. It can be difficult for adults to differentiate what is typical behavior for a youth and what may be a warning signs of a mental health or substance use challenge. Let's look at some of the differences between typical behavior for youth and potential warning signs. Withdrawing from family to spend more time with friends can be typical adolescent behavior, while withdrawing from friends, family, and social activity can be a potential warning sign. An adolescent may occasionally lose their temper when things do not go their way. However, frequently arguing with adults and or purposely breaking rules and displaying aggressive behavior can be a potential warning sign. Moving from childhood likes to teen pursuits is a common behavior of adolescents. Losing interest in favorite activities and not replacing them with other pursuits could potentially be a warning sign. Youth may sometimes struggle to complete an undesired task. However, if they are having difficulty remaining focused and maintaining concentration across a variety of tasks and settings, it may be a potential warning sign. It is important to note that if you are unsure if the behavior is typical or a potential warning sign, you should engage in a conversation with a youth to try to find out what is typical for them and to open a dialogue to see if there is more they want to share. Next, you will get a chance to practice. It's time for a knowledge check. Listen to each of the following scenarios to determine if the youth is demonstrating typical adolescent behavior or a potential warning sign. Select the Start button to begin. Meet Chris. Chris is a 10th grade student in your math class. He is bright and athletically talented. He played on the soccer team last year but decided not to try out this year. When you ask him why, he says, "It's not like I'm going to play pro or anything. Besides, I have a lot of stuff going on at home." He used to hang out with guys from the soccer team, but this year he eats lunch alone. He is missing a lot of classes, and when he does show up, he usually asks to go to the school nurse because he isn't feeling well. He has been withdrawing from friends, family, and social activity. He is also losing interest in favorite activities and not replacing them with other pursuits. As a mental health first aider, would you describe this as typical adolescent behavior or a potential warning sign? Chris is withdrawing from friends and social activities and appears to have lost interest in a favorite activity. These are both warning signs that indicate a first aider should start a conversation with Chris to find out what is going on. Meet Jen. Jen is a 9th grade student who plays on your volleyball team. Her mom requests a meeting with you because she is concerned about Jen. Jen is withdrawing from family to spend more time with friends. She no longer wants to do ballet, which was her childhood passion, and instead is focused on volleyball. You notice Jen is a perfectionist during practice and loses her temper when things do not go her way on the court. She gets emotional when the team loses. As a mental health first aider, would you describe this as typical adolescent behavior or potential warning sign? Jen appears to be experiencing typical adolescent changes such as wanting to spend more time with friends, pursuing new interests and activities, and expressing strong emotions. A first aider may not be overly concerned about Jen based on the information presented here, but should always continue to assess the situation as things can change. It's time for a quiz. Select the Start button to begin. True or false? The purpose of youth mental health first aid is to help a young person who is experiencing a mental health challenge, disorder, or crisis until the appropriate help arrives or until the crisis resolves. You selected the correct response. The role of a first aider is to diagnose and treat youth who are experiencing a mental health or substance use challenge. Observe changes in behaviors, listen non-judgmentally, and serve as a vital link to early intervention. Prevent bullying at school, or avoid eye contact at all times. You selected the correct response. True or false? First aiders can diagnose or treat anyone with a mental health or substance use disorder. You selected the true or false? A sign is an observable behavior that indicates that there may be a physical or mental problem in the body. You selected the correct response. True or false? A symptom is an indicator of a physical or mental challenge in the body that you cannot observe, but may hear a youth describe. You selected the correct response. Where can you find more information about the mental disorders that most impact youth? Mental Health First Aid Manual for Adults Assisting Children and Youth. You selected the correct response. Which of the following is an example of self-care? Going for a walk outside or reading a good book. Eating a healthy diet and getting enough sleep. Spending time with people you enjoy. Getting enough physical activity each day, or all of the above. You selected the correct response. Which of the following actions are within the scope of a first aider? Diagnosing. You selected the correct response. Good job. Which of the following may be an early indicator that a youth is experiencing a mental health or substance use challenge? Difficulty remaining focused and maintaining concentration across a variety of tasks and settings. Withdrawing from family to spend more time with friends. Occasionally losing their temper when things do not go their way. You selected the correct response. The most common protective factor for childhood resilience is having at least one relationship with a supportive adult. Regularly attending school. Receiving recognition for academic or athletic success. The ability to hide emotions. So, you selected the correct response. Which of the following statements is true about the Algae Action Plan? The 5-step action plan must be performed in a linear pattern, starting with A and ending with E. First aid is not complete until the first aider has used all steps of the action plan. First aiders do not need to use every step of the action plan if they are not called for in the circumstances. So, you selected the correct response. Good job. How can a first aider best cope with feelings of discomfort or frustration associated with providing first aid? Establishing a self-care plan before providing first aid to cope with any feelings that may arise after the first aid event. Using alcohol or drugs to numb the pain associated with the first aid event. Avoiding social situations that may bring back memories of the first aid event. You selected the correct response. Good job. Thank you for completing the quiz. Please select the Proceed button to advance. Before we conclude the online youth mental health first aid course, we will spend some time discussing self-care and how you as a first aider can take care of yourself when helping young people. Self-care is an important part of being a first aider because we need to take care of ourselves before we can effectively help others. Upon completion of this section, you will be able to define self-care, identify self-care activities, and manage mental challenges using a self-care plan. So, what is self-care? Self-care is the action a person takes to achieve wellness and preserve or improve their health. The Substance Abuse and Mental Health Services Administration's SAMHSA 8 Dimensions of Wellness recommends a broad approach for things people can do, at their own pace, in their own time, and within their own abilities, that can help them feel better and live longer. Select each button to learn more. Interacting with others is an essential part of the human experience. Developing a sense of connection, belonging, and a well-developed support system can help a person feel socially well. Occupying pleasant, stimulating environments that support well-being leads to environmental wellness. While we are not always able to choose what is in the environment where we live, work, and play, individuals can take small steps to make their surroundings safer and limit their exposure to potentially harmful substances and influences. This may include physical wellness strategies to decrease stress and increase energy, coping skills to adapt to change and difficult times, and positive social and community habits to stay mentally and physically healthier. Although we often associate learning with school, learning is a lifelong process. Lifelong learners achieve intellectual wellness by recognizing ways to expand knowledge and skills through intellectually stimulating activities. Some examples include learning because you want to, staying abreast of current affairs, having thoughtful and stimulating discussions on new and familiar topics, recognizing the need for physical activity, healthy foods, and sleep. When a person is emotionally well, they are coping effectively, having a sense of positive self-regard, and creating satisfying relationships. Some ways a person can achieve emotional wellness are keeping a positive attitude, being sensitive to their feelings and the feelings of others, learning to cope with stress, being realistic about their expectations and time. Spiritual wellness occurs when people attend to their sense of purpose and meaning in life. This can be achieved by deepening faith or religious practices, exploring different cultures and religions to find a potential spiritual connection, defining personal values and ethics and make decisions that complement them, spending time alone in personal reflection, being in the here and now. Financial wellness comes with experiencing satisfaction with current and future financial situations. Having enough money to meet your needs, balancing wants with needs, and saving in alignment with your personal goals are some ways to ensure financial wellness. Occupational wellness is derived from personal satisfaction and enrichment with one's work. This kind of work is not limited to employment, but can also include volunteering, studying, caregiving, or other activities that provide a meaning and purpose to life. Self-care is an important tool to help achieve wellness. It is much more than achieving the absence of symptoms. Self-care is a deeply personal process of regaining physical, spiritual, mental, and emotional balance. The experience of self-care means different things to different people. During the stressful times in life, people naturally bring stress with them everywhere they go, including the workplace. Whenever you feel overly stressed, it may be a good time to focus on self-care. Do you think self-care is beneficial? If so, when was the last time you did something to take care of yourself? If it has been a while, now is the time to plan for your next self-care activity. How might self-care help you maintain balance in your life? You may sometimes have feelings and thoughts related to your own challenges after encouraging someone. If you find yourself feeling upset after listening effectively to someone, you may need to take part in good self-care habits. Select each tab to review a self-care activity for each of the wellness domain.
There are several national helplines available to help those who are experiencing a challenge or a crisis. If you or someone you know needs help immediately, please call 911. Select each button to learn more about some of the helpline resources that are available to you.
Here are additional resources for your awareness. Select each button to learn more. There is a handout you can download in this course with many of the support resources we discussed. During the final section of the course, we discussed the benefits, advantages, and importance of self-care for someone who has experienced or is experiencing a mental health or substance use challenge, as well as for the person who has provided support. You should now be able to define self-care, identify self-care activities, and manage mental challenges using a self-care plan.
Having a supportive conversation. Here, you will get a chance to find out how a mental health first aider might apply some of the skills they learn throughout the mental health first aid course to provide support to someone who seems to be experiencing a mental health or substance use challenge. The skills that will be provided include effective listening, providing encouragement and reassurance, providing resources and information, and discussing the importance of self-care. Hi, I'm Mark. I'll be your virtual guide during this portion of the course. I will check in with you a couple of times along the way to find out how you're doing. With that being said, let's get started. Next, we will observe a conversation between two people who are working to support a local charity. Laura, a mental health first aider, notices that something is going on with Jeremy, one of the student volunteers. At some point during the conversation, you will need to make key decisions that will help Laura achieve her goal of helping and supporting someone who appears to be sad and not their usual self.
Jeremy, can we talk for a few minutes?
Sure. What's up?
You have been in a not so good mood for the past several days, and that's not like you. Is everything all right?
Everything will be all right. I've been dealing with a few things, but I'll get over it.
I'm concerned, and I'd like to help. I've found that sometimes it helps to talk to someone. If you'd like to, we can speak privately in the office. How's that sound?
Sure, we can talk. I'm not sure how you can help me. I doubt anyone can help me.
In the next few minutes, Laura and Jeremy will continue their conversation in a more private setting. Let's find out if Laura will be able to help Jeremy.
Thank you for agreeing to talk. You haven't been your usual self lately, so I thought it would be a good idea to ask you if anything's going on. Can you tell me how you're feeling?
I feel okay, I guess. Around this time of year, I keep thinking of a friend who passed away. So it's pretty sad. I can't stop thinking about it.
What do you do during the sad times? How do you cope?
I basically flip through pictures, think about the good times, laugh, cry, try to keep myself busy and hope I feel better.
That sounds tough. Are you talking to anyone about this?
Let's see, there's you, one of my friends on my softball team, and that's it.
Help Laura make the correct choice. Should she A. Tell Jeremy that his sadness will soon go away, B. Talk about how she got over a similar situation last year, or C. Suggest that Jeremy talks to a professional about his situation. Select the correct answer to find out what happens.
Have you considered speaking with a professional about this situation?
Answer C. Suggest that Jeremy talks to a professional about his situation is correct because Laura is not qualified to give advice. The best thing to do is to provide Jeremy with information that can help him get the help he needs.
Jeremy, have you thought about speaking to a professional? Someone who specializes in helping people talk about and deal with feelings like the ones you described?
Never thought about it. I'm not sure how to start. On top of that, I don't know if I can afford it.
Can I give you some information that'll help get you started?
Yeah, sure, I guess so. I'll take a look, but I'm not too sure.
I'll get you that information before the end of your shift. There'll be a phone number you can call and online resources you can access. I'd recommend you give it a try.
Yeah, I can at least make a call to see what it's about.
Good. If you want to use the office phone to make a call, you can. I'll even sit with you while you make the call if you'd like me to. It's up to you.
Yeah, I think I'll do that when I get home. Thanks for this talk.
You are very welcome. I want to see you happy. Talking to a professional is a good first step.
Yeah, it's a big step, but I think it's worth it.
I'll check on you in a day or two to find out how things are going and if you need me to help connect you with someone.
Okay, thanks. I'll let you know how it goes.
Oh, one more thing. You should consider doing more things that you enjoy. It might help you recharge and feel better.
Yeah, I do play softball, but I suppose I could think of other things to do.
I know what you mean. Please give it a try. Write down a list of things you like to do and make plans to do them. For instance, I like to run, write poetry, and volunteer at a local community center twice a month. I found that when I do these activities, I have fun and I feel good about myself.
I get it. I'll make a list and try some things out.
Laura did a good job of helping Jeremy during a challenging time in his life. She showed compassion, empathy, and kindness while letting him know that she cares about his well-being. This made Jeremy feel comfortable and heard. He was even willing to discuss how he felt and receive information to help him find a professional to talk to. Laura provided us with a good example of how to help someone who is in need.
Congratulations! You've completed the 2-hour self-paced module in the online portion of this course.
Well, that concludes our introduction to mental health first aid. My name's Ed Frontera. Thanks for your time.